Alzheimer's disease affects millions of people and their families, but a new drug is offering hope.
And researchers say it slows down the progression in the brain. 10 News Side's Ashley Knight talked with a local doctor and patient about this. Ashley?
Right, good evening, Tom. Aisha, to show how big a deal this is, the last drug to be approved by the FDA for Alzheimer's was back in 2003, and it was just to treat the symptoms. I spoke with 75-year-old Norman Colpitts, who has been on one of those new drugs now for a year and a half. It began with a gentle nudge from Norman's wife, Susan.
You know, you're slipping a little bit. Maybe we should get a test.
The former elementary school teacher lost both parents to dementia, so he took a couple memory tests, and then doctors suggested a PET scan.
He brought it up on the screen, and there was this kind of ink spot, and he said, "That's it. You got it."
How did that make you feel?
I don't know, life-changing is a little heavy, but you know, I mean, like I say, I'm 75 anyway, so. But that was really a kind of a slap in the face, and a wake-up call, I guess, more.
Devastation quickly pivoted to hope.
Well, there is this new treatment.
2 drugs were just approved by the FDA in 23 and 24, both proven to help slow progression of memory loss.
What these 2 medications do, these are anti-amyloid antibodies. So essentially, these are antibodies. They cross our blood-brain barrier, and they bind to those amyloid plaques.
Amyloid plaques are those ink spots that Norman said he saw on his PET scan. By bonding to those, the antibodies can remove them.
And these are quite powerful medications. So by 18 months, majority of people who take these medications, their brain is cleaned up.
In some cases, the plaques are completely removed and they can stop treatment. Amyloid plaques can actually form on the brain 20 years before showing any symptoms. Dr. O says this medication is only approved for those in the early stages of Alzheimer's.
Time is an essence right now because we have medications that we can change the trajectory of Alzheimer's disease. It's just a matter of time.
If you get it in that early stage, you got a chance. If you wait, you're not getting rid of that plaque. I feel incredibly lucky. That's the takeaway from this thing. Lucky.
Norman is working to increase his odds. He's taking piano lessons, he's eating healthy, and he's staying fit. Meanwhile, Dr. Okravi says we could see a vaccine to prevent Alzheimer's sometime in the next 10 years. Ashley Knight, 10 on your side.